Good afternoon, everybody. Here this afternoon with Dr. Shahab, the Chief Medical Officer for the province of Saskatchewan, and also John Ash, who's Executive Director with Saskatchewan Health Authority in charge of emergency planning. So I'm going to just make a couple brief comments. I would then I'll ask Dr. Shahab to make some comments, and then we'll go to questions for everybody. First of all, I just want to say that Dr. Shahab, Chief Medical Officer for the Ministry of Health, and John Ash here with SHA, both agencies, both the Ministry of Health and the Saskatchewan Health Authority, have been informed by the government a number of times that they have all the resources necessary from the government to operate as we deal with this COVID-19 pandemic. So I think there's been a great deal of interest, obviously, in the ministry, including yesterday, and I know you have a lot of detailed questions, and these are two gentlemen that I think can really get into the nuts and bolts of the planning that's going on. So with that, I'm going to ask Dr. Shahab to make some comments, and then we'll go to any questions you might have.
So good afternoon, everyone. So just wanted to give a bit of a national update, international update, national and then provincial. So internationally, obviously, the WHO has announced that we have a pandemic. It was something that was being expected for quite a while. It doesn't really make any difference to our planning assumptions. All it means is that it's now circulating in well over 100 countries, and several countries have established community transmission. In Canada, of course, we have 93 cases of COVID-19. BC has 39, Ontario 36, Quebec 4, and Alberta 14. In Saskatchewan, we still do not have a case, but we are fully aware of the need for testing anyone who has traveled or has been on a cruise that has run into problems or has been to a mass gathering. So with that, in view of that, our testing numbers are going up significantly. We are now at 204 persons tested, and 202 are negative, and results are waited on 2. But every day we get concerns from people who have traveled from anywhere in the world, because the recommendation now is that if you've traveled from anywhere in the world, or you've been to a mass gathering, a big conference anywhere in Canada, if you come back to Saskatchewan, go about your work, but just be aware of your symptoms for 2 weeks. Self-monitor. It's a good area actually to use a thermometer twice a day. If you get fever, cough, any symptoms, self-isolate. Don't go to school or work. Call Healthline, and then you will be assessed for further testing. And that is the best way for the time being, to make sure that if we do get a case, which we will ultimately, we have minimized any contacts with others, and hopefully people will recover for the most part at home. That's been how most people in Canada have recovered. They've done well. It's a mild illness. They've recovered at home in a few weeks. But obviously, if we get more cases and we need ICU care or hospital care, those plans are in place as well. So that's just a brief summary of where we are at now in Saskatchewan and Canada. I don't know, John, if you had
No, I think just open to questions, yeah.
Sure. So we go straight to questions.
Saskatoon Corrections is under its current protocol.
Sorry?
Can you speak to why Saskatoon Corrections is under its current protocol?
So all institutions, schools, universities, corrections, they have updated their own guidance, and there's a provincial EOC that's been set up as well. So obviously all facilities look at what do we need to do now, and if we have a case or an employee or someone we care for who has symptoms, how do we proceed? Which really is to engage public health to.
Can you speak directly as to why Saskatoon Corrections is under its current infectious protocol?
Yeah, so we.
That's why. Is
so
there a specific case? I guess I should have been more clear in my question.
There's always whenever there's a person who has traveled, or may have been in contact with someone who's traveled and has a fever and cough, a specific protocol is put into place. So it can happen in corrections, it can happen in the school, it can happen in a university. And that's happened several times in the past, not just in a correction facility. It's happened in several schools. It's happened in several situations in the university setting. And then there's a systematic way to isolate the person. Obviously, if the person is living there, like in a university or in a correction facility, make sure that the person is adequately isolated. And for COVID-19, that's not hard. Even people who have been patients can recover at home with other household members in other rooms. And testing is done, and further inquiries are done that if you were a contact of someone who has traveled. So that's just a routine process that is ongoing in many settings.
Can you tell us what the protocol would be to cancel events? Who's making those decisions? There's
Yeah.
some questions about the Junos and others, things like
Yeah,
that.
so there's a lot of awareness throughout the world, especially in Europe now and in North America, especially in the US, about mass events and gatherings. So again, we have a systematic process on that. So we, including local medical officers of health, we have a line of sight about all events happening in the future. For each event, there's a risk assessment done. How big is the event? What is the setting? Who's coming to the event? Are there going to be a lot of people coming from internationally? Is it mostly going to be younger people, older people? What's going to happen at that event? So for the Junos, again, the federal government, ourselves, and local officials in Saskatoon have been working with the event organizers. And given our current risk assessment in Saskatchewan and Canada, we have said the event can go on, but we really encourage some special social distancing measures, which means don't go to the show if you're sick. Even if you have a ticket or you're a celebrity who's come, you land in Saskatoon, you've got a fever and cough, stay in your hotel, get assessed. If you're well, attend, but minimize, handshakes, hugs, kisses. We'll see on Sunday how successful that is. But, practice social distancing, and that's a good thing to start modeling. Right now, the risk is low at these things, but we need to practice because we know this is not going to go away in a month. COVID-19 is going to continue for months, till it, either goes away or becomes a routine thing. So we need to practice social distancing as a habit. Still, if someone offers their hand, there's almost an instinct to reach out, but then you bring your elbow up, cough in your sleeve. So I think that's what our recommendations are at the moment. But again, there's many events happening throughout Saskatchewan as we go forward, and for each, there'll be risk assessment. What's the current situation in Canada? What's the current situation in Saskatchewan and in that locality? And who's coming to the event? And then the guidance is given based on that.
As far as closing schools down, would that require one person to get sick, a death? Like,
Yeah.
what are the sort of parameters around
Then
that?
I'll have to come here and then.
Yeah.
So again, currently the guidelines are that if a child is sick, even if they haven't traveled, don't go to school till you're better. If a child has traveled somewhere, anywhere in the world, gets a fever, cough, stay at home. Even if a child is in school and suddenly becomes sick, someone's child has traveled, come back from Europe, develops a fever, cough in school, there's no need to panic. The child can sit in a room with the door closed, parents can be called, they can get the child, take him home. If the child has to take a bus home, the child can sit in the bus, you keep a row empty front and behind, the child goes home, testing is done. Even there, if someone has traveled, chances are it's not going to be COVID-19, it's going to be another respiratory illness. But these simple steps will minimize contacts with others so that even if it is a positive test result, there's minimal risk of transmission to other students. Now that's the plan for a single child who gets sick. But as you know, Italy has closed all schools, Japan has closed all schools. We're certainly not there in Canada yet. But there are plans in place that if we were to have sustained community transmission, there will have to be a point where we'll have to enact. Right now we talk about individual social distancing. If you're sick, stay home. If you're out and about, avoid a lot of contact, wash your hands often. But if you have a lot of cases in one particular community, we will have to look at what measures in that community, which could include closing schools, which could include other measures, may reduce transmission. But we have to remember, whenever you do that, children may then congregate somewhere else. They may go to a mall, they may go. So you have to balance the benefit and the risk, but generally we try to avoid any disruption as far as we can.
The World Health Organization called it a pandemic
Yeah.
Because countries just simply weren't doing enough to stop the spread of this. What's your recommendation in regards to this government potentially calling an early election? And is that a threat to the safety?
So the government called it a pandemic because initially they felt that this could be contained to a few countries. And we have to remember that more than 100 countries have cases now. In most countries, they are just limited to travel or limited person-to-person transmission. But a few countries, China, Iran, Italy now, are seeing sustained transmission. Cases are in the thousands. Some countries in Europe, France and Germany have crossed the 1,000 mark. So it is an evolving situation. But we obviously need to monitor the situation globally. But locally, we need to plan for the long term. So at the moment, we don't have any cases. Alberta has 14, Manitoba has none. So we do a risk assessment of where we are now. We may get a case today, tomorrow, next week. We may get more cases in a week or two. We may not get any cases for a month. But we need to make sure that people who have traveled get tested and screened, cases and contacts are identified early. So as long as we can maintain that, I think we need to allow routine things to continue as long as possible. But we still need to practice that social distancing, which is part of our daily
Sure,
awareness.
but
Sorry, you guys, there's a
sorry,
bunch of questions.
I asked
We're-
what your
we're- I'm gonna-
recommendation would
okay, I'll
be
get to
in
Murray.
regards to introducing an unplanned public event. What would your recommendation be?
Unplanned public event
Like an early election.
So-
In a time where we have a pandemic and the World Health Organization has stated we have yet to contain contain a pandemic.
So I would say, and
So
I
the
know,
recommendation,
I don't know,
please.
several countries are having this discussion, not just Saskatchewan. In the US, there's an election, I think, in November. But I think irrespective of what's happening in Saskatchewan, no cases, a few cases, a lot of cases, if there's something like an election, it's like, the election itself is like going grocery shopping. And, even if you have a pandemic, you have to go grocery shopping. You shouldn't go grocery shopping if you're sick. You should, maybe get someone else to do the groceries. And if you're sick, similarly, even during flu outbreaks, people who are sick in a long-term care facility or home with influenza have been able to vote through, other means, postal ballots and other means. And when you go to grocery shop or elections, you want to minimize, especially in the current environment, which may continue for months, you want to minimize close contact or hand-to-hand contact, so you stand 2 meters apart. When you show your ID and you vote, you want to minimize handing things back and forth. You can wrap up. So, there are means to minimize exposure if there's an election. And obviously, if there's group events prior to an election, you want to, again, practice social distancing. Now, that's the recommendation for if situation remains as it is now. If there's a lot of community transmission, and we have to remember that even in BC, Ontario, most of the cases are in particular parts of the province, not throughout. But if you have a lot of community transmission in a specific part of the province, then in those areas you may have some further restrictions on, for example, mass gatherings, which could be, the kind of public events that happen before an election or other events that happen, sporting events and other cultural events. So there may be specific advice. But at this point, it is impossible for me to predict when that would happen, and the advice would have to be based on, what's happening in terms of the risk, and then what the event is.
Well,
Dan,
Okay,
that's
so,
like-
sorry,
almost the
yeah,
antithesis
sorry,
of,
Dan and then Wayne, or Murray, sorry.
My question was asked.
Sorry, Murray, everybody was trying to jump in. So Dan and then Murray.
Seamus Reagan is sick, and he's been in northern Saskatchewan last week. Have you had any update from him and discussions with community leaders about his possible infection?
So I will only comment on this because I think he tweeted the fact that he was isolating. But without commenting specifically further on an individual, whenever we get information that someone was tested for COVID-19, we rely on our provinces and territories to let us know if the test is positive. So if a person came to Saskatchewan, went about several places, went back to their home jurisdiction, was tested, if the test is negative, there's nothing to worry about. If the test is positive, as part of contact tracing that jurisdiction, or we will ask, where were you in the last, during the period of time that you were symptomatic? And when that person says, well, I was in Saskatoon, I went here, went there, then we will get that information that this person was positive, he went here, here, and here, and had close contacts with these people, and then we'll follow up with those individuals to say, monitor yourself for 14 days. If you get fever or cough, self-isolate and call Healthline for further assessment. So there's a systematic process, and that has happened, obviously we don't release people's names, but that's been ongoing. People, have come to Saskatchewan, gone elsewhere, tested positive, and then we assess were they symptomatic when they were here, and we follow up with contacts, and that's a routine thing that public health does that we've been doing for the last several weeks now in many instances.
Sir, an election is really the antithesis of social distancing because of everything you described. You're touching people, you're in large crowds, there's voting ballots back and forth. It's a month-long event. So I guess I'm wondering, what are you telling, we know you're meeting with Elections Saskatchewan every now and then because they requested, the Premier said you're meeting with them. what are you telling them about the relative dangers of having an election now, having it later, having it at any particular time? That those conversations must go on from a planning standpoint.
Yeah.
So we'd like to know in terms of how this might affect the public if an election is called.
So at this point, it is impossible to forecast if we will see cases. We likely will see some cases. Will we just continue to see a few cases that are travel related and a few contacts that we can easily identify for many weeks or many months, and that means that we have good containment? Or will we see evidence of community transmission, which means an outbreak in a long-term care facility without any knowledge of anyone being sick who was visiting, or any other evidence of community transmission? So right now, for the actual voting, there are ways of doing it safely. And most experts are saying that this is something that will certainly continue into the next year in terms of, I think, and this is not a reason to make everyone panic or anything, but, we're only in our 10th week of this epidemic, only in our 10th week. But what we have seen from Wuhan and other provinces and what we're watching Italy closely now, and France and Germany, is that you can get a lot of cases very quickly, but then you can intervene by very drastic measures, which you put in place at that time. You can't put them in place before, or but you have to put them in place at the right time. But
Can we focus on that for a second?
Yeah.
I think that's where it answers my question,
Yeah.
because when you have a month-long event, start an election, you can't really stop it. Can't really, in the middle of a
Well,
campaign, say, no, we
I
can't
think,
have it anymore because we have an outbreak of.
yeah, I would say that whenever an election is called, if after the election is called, there's evidence of increasing transmission, rapidly increasing transmission, like Italy, I think serious consideration will have to be given to what steps can be taken to minimize further transmission. So yes, you can put very restrictive measures in place, either locally or more broadly, depending on what's happening at any time.
And that would mean no public gatherings, those kind of things, no handshaking, no whatever else.
Yeah,
That would be a
handshaking,
very
we're saying you
effective
shouldn't
campaign.
do in the age of COVID for the next few months. I think that social distancing, and it applies to meeting friends and family at home. It applies to going for your, religious ceremonies. It applies to going to birthday parties. I think that social distancing is hard for us to put that distance, but we need to put that in place anyways, and that needs to continue for many months. I think that the discipline to not visit someone in a long-term care facility if you're sick. We always say that in flu season, that needs to now continue over the summer. So those things we need to put in place anyways. And whether it's a gathering for an election, or whether it's a sporting event.
Are we in a particularly vulnerable state right now? Or is it possible it'll be better in the summer, in June, and October?
Those are all hypothetical questions. Obviously, people have said that if it behaves like the normal coronaviruses, obviously coughs and colds go down in summer. But having said that, many countries which are warm and humid, like Singapore, have had their clusters in the current weather. So I think it's hard to predict, but I think we just need a higher level of awareness anyways. And if we start seeing cases whenever, we need to just heighten our protocols at that time. And if we see community transmission, and we can't predict if and when that'll happen, then we need to make interventions within that setting, which may not be the whole province right away, but within that setting.
In other provinces, before there was a confirmed case, there was a presumptive case. Are there any presumptive cases in Saskatchewan?
We don't have any presumptive cases. We have 204 people who have been tested, 202 negative, and 2 where tests are pending. So again, it takes 2 or 3 days to get the results.
Dr. Shahab, you mentioned that large public events are going to be subject to some kind of risk assessment.
Yeah.
I just want to be clear, would an election campaign be subject to that same kind of risk assessment? I know it's not the same thing as like the Junos, but I mean there would be a considerable amount of social activity. So would it be subject to the same risk assessment?
Yeah, so I was going to talk about other things like this fundraising events, but same principles apply. If you're going door to door, maybe don't do the handshake, and obviously you have a sanitizer to wash your hands. Any group gathering, whether it's a sporting event or a music event or a religious gathering, or a meet and greet or a town hall, social distancing rules should apply. If you are at higher risk, elderly of underlying risk factors, and there's evidence of community transmission locally, you probably should not attend. But again, if there's evidence of uncontrolled local transmission, and nowhere in Canada is that happening right now, but if there's evidence of uncontrolled local transmission, that's when you can cancel an event. And then you can then have other means of holding that event. Like in Italy, they have had, I think, soccer games with no one sitting in the audience. They've had fashion shows with no one sitting in the audience. So there are ways to do events in a way that you minimize, but it all depends on what the local situation is at that point in time. And we, at this point, cannot predict that at all. I think there's no sustained significant local transmission anyway. Canada right now, the US is watching very closely what's happening in Washington State and New York, but beyond that, they have a cluster of cases linked to travel or sometimes some local transmission, but that's very limited, and we have to watch very carefully how this evolves.
If you're telling
So,
people,
I just want
if you're telling people to watch themselves for symptoms if they travel at all, are you recommending that people don't travel?
So that's a really, I think, important point. So if you go to the Public Health Agency Travel Advisory, they have kind of three categories, 3, 2, and 1. 3 is don't travel. So they're saying don't travel to Hubei or China, don't travel to Iran, don't travel to parts of Italy. And that's because of high levels of transmission there. And also because there could be restrictions on you once you travel that you can't travel back. Many flights are being canceled even to Italy now. So there are many reasons why. Then there's countries like Japan, Singapore, South Korea, where there's large clusters, but they are identified clusters. So like South Korea has a large cluster within a certain church group. So those are identified clusters. And then you can travel, but enhanced precautions. Know where the clusters are, this city, that city, and just enhanced precautions. Don't go near someone who's sick, sanitize your hands. And then general precautions apply everywhere. France has 1,000 cases. You can travel to France, but just be aware, use enhanced precautions. But we have to remember that the WHO situation reports is what I look at every day. It lists all the countries, the number of cases. Just because a country does not have a lot of cases doesn't mean there aren't a lot of cases. All countries don't have the same capacity that European or industrial economies have or North American countries have. Many countries struggle to bring up their testing numbers. So these precautions now apply globally. It doesn't matter if a country is not reporting any cases. You need to practice these routine precautions anywhere you travel. And I'm recommending even within Saskatchewan, because that will just get us all trained up to when we do see local transmission.
So you're not recommending that people don't travel?
Well, there are some specific recommendations. There's some specific strong recommendations for not going on cruise ships by the federal government. That's because we've had numerous events now where there's transmission in cruise ships. When you go to large conferences, again, be especially aware of your social distancing measures in conferences. And if you are elderly, you have underlying risk factors, you need to do your own risk assessment and see, is this a good time to travel? It may be fine in one setting, it may not be fine in another. You have to look at if you get sick, what are the healthcare facilities where you're traveling, those kind of things.
What have we done to
So I just want to make sure that
ultimately social distancing is a self-monitored practice, right? So
yeah.
let's say someone paid expensive ticket to the Junos and they're feeling a little bit sick and they're like, oh, I'm fine, and they end up going. What precautions are there in that case? Like, is it security's duty to kick that person out? Like, what happens then?
So all these things are very hard to police, and you really have to rely on people doing the right thing. And I guess if there was, so that's at this point. If there was sustained community transmission, then Italy has put in steps that when China put in those steps, people thought, Europe and the West and North America will never do that. But there you go. Italy has put in steps where you're not encouraged to leave your house. You can only go for short periods to shop. You're not able to go from city A to city B. So those are significant measures. We're still learning about how effective they are. They seem to be somewhat effective in China. I think it'll be good to see what happens in Italy. Does that bend the epidemic curve? But I think there can be more restrictions put in place. But ultimately, you have to rely on people, and it is tough because people may have bought a ticket for a holiday or a cruise or an event, and they may choose not to go. Or if it's cancelled, will there be reimbursement? Or if it's rescheduled for a future date? I think those are all things that people need to think about.
Well, there was that case in Toronto where the guy went to the mining conference and he was confirmed to have COVID-19, and there was 2,000-3,000 people at that conference, right? So like, how are like EMS staff or security staff being trained into recognizing symptoms?
I think generally it's not possible to screen people for large conferences at this time. I know airlines like Air Canada said that they may screen people boarding who are not sick, but that happens anyways. They don't like people getting on a flight who are sick because that may cause other challenges, not just COVID-19. But I agree that it's a trade-off between you don't want to cancel everything for months because that's just not that's very disruptive. But it's a trade-off.
What's your thoughts on the cancellations so far? Because we're seeing large events. I think today was the World Figure Skating Championship, and it's day after day. What's your thoughts? Is that being overly cautious in the jurisdictions that are doing so, particularly those jurisdictions that may or may not have active cases or clusters, as you described?
I think again all jurisdictions are making their own risk assessment. Who's coming? Which countries are they coming from? If there are a lot of people coming from Europe or other parts of the world, Asia Pacific, where there's large clusters, that's a separate risk assessment than a lot of people just coming from within Canada. But I agree, every jurisdiction needs to make that assessment.
Or do you think they're making I wouldn't say the wrong assessment, but are they being overly cautious? Are they being
I think
I
it's.
framed that once again, the possibility that we, at some point this year, are going to be in an election cycle.
Yeah.
And I guess we have to make a decision as to whether that's.
I think you have to balance the benefit and the risk, and you can't sustain canceling everything for months at a time either. And you really it's a trade-off, and I think you have to balance that. And that's the best I can say. I know in the U.S., many universities are saying that after the end of March, the rest of the April term will be online. Canadian universities are not there yet. But again, I think universities, other institutions are also making their own risk assessment. But for universities, it's different because once April is done, then there's a break over the summer. But I think there's no perfect tool. But the best you can do is who's attending, where are they coming from, and based on that, a benefit cost.
What have we done to ready our hospitals?
Actually, the SHA has actually been working very diligently for the past number of weeks, certainly in partnership with the Ministry of Health, preparing for. So there's existing pandemic plans, and past number of weeks, there was a transition to focusing specifically on COVID-19 because there's certainly known things about that. So we've engaged, and I think this is one of the benefits of having a single health organization. We've engaged the organization as a whole and established operational plans down to the area and local levels. So I actually just drove in from Saskatoon where we were doing our Emergency Operations Center was set up, and part of that is just to ensure the organization is focused on doing the right work and preparing for it. And certainly I'm very impressed with the degree of effort that's being put in place.
What kind of more resources do we need?
Well, it's more about aligning staff and focusing them on the right work. So whether it's that's aligning community testing or preparing our acute care facilities or working with our family practice physicians and community, really around what are those messaging around PPE, getting the appropriate information to staff around screening and so on and so forth. So that we're consistent as a health organization.
Alan? Yes. Just one thing that you kind of touched on earlier was that the SHA as a whole, one of the reasons it was brought in was to better deal with something like this. So what benefit is having one amalgamated health region been in the face of COVID-19?
Well, I think a very clear and clean example is how we manage supplies. So this is a worldwide event. Everyone is requesting and requiring that particular amounts of equipment and supplies. So now that we're a single health authority, we can actually identify as a collective what are the resources that we have. We can leverage bulk buying and working with the province and sort of the federal government to kind of get the equipment and supplies that we need. And if in the event that there's an area of greater need, we can shift resources to be able to meet the patient need.
Can one of you speak to the difference? I know we've gone over this before, but there seems to be a lot of people still dismissing this as saying, oh, it's just the flu, or one of you want to speak to, just to the audience here, what the difference is between COVID-19 and what makes difference from the flu?
So SARS 2002, coronavirus, novel coronavirus, Over 1 year, there were 8,000 cases in several countries, 800 deaths, 400 cases in Canada, mostly in Toronto, 400 deaths. It was put back in the box through public health interventions, It didn't become a mass event. MERS-CoV, transmitting since 2012, another novel coronavirus, jumps from camel to someone who works with camels or has camels to 2 or 3 other people in the household, stops. SARS has a mortality rate of 10%, MERS-CoV 37%, very scary stuff, but hasn't become anything big. Influenza comes every year. Mortality rate is 1 in 1,000, more in elderly with underlying risk factors. There's vaccination that this year is very effective, 60-70%. There are antivirals, other medications. You can't really contain it, and that's what WHO kept saying, that you really can't do contact tracing like we're doing with COVID-19, because once it's there, it does its rounds. So you don't put people in quarantine and that kind of stuff, but you do the general stuff, social distancing, don't go to school or work. You try to spread the outbreak, minimize the spike, and then manage through vaccinations. And also, there's a pressure on acute care ICU every year during flu season. So that's now COVID-19 is in between flu and SARS. It has a mortality rate of 3%. And we have to remember, mortality rate right now in Italy is higher than Wuhan. Italy has a very good healthcare system. Wuhan had a good healthcare system. Wuhan, the spike was rapid. It overloaded their healthcare system. Italy, the spike has been very quick. They've put in mass control measures like quarantine. It's still putting a lot of pressure on the healthcare system. And Italy has one of the oldest populations in Europe. So, it's very important to see how this plays out in Italy. Because we're learning from that. But it has a mortality rate of 3%. In 80 plus, it's higher, around 14%. 10% in kind of adults 60 to 80 with underlying risk factors. It's very low in persons under the age of 20, and maybe less than 1% in younger adults, and anywhere between 2 to 5% in mid-age adults. Higher if you have underlying risk factors. So the gradient is different. If it comes quickly and you don't do anything to control it, it can put a lot of pressure on the healthcare system. It doesn't matter how much you plan, it still strips your capacity. And that's why individual measures to delay the arrival are important, and public health measures, which will be very uncomfortable for all of us, that you can't leave your house for 2 weeks, work from home if you can. Only essential services go to work if you're working in healthcare, working as a water plant operator. If it comes to that, those measures will have to be applied, and they're new for most of us. We've never seen that happen. But that is the attempt to flatten the curve. Ultimately, if most of us are going to get exposed, we want all of us to get exposed over a year or 2 years. We don't want all of us to get exposed within 1 to 2 months. So that's the whole principle of public health measures, containing, delaying, but also mitigating in terms of providing care when required. And last comment I want to make, and I've been saying this for a while, is that we all need to think about, if I'm asked to stay home for 2 weeks because I've got a fever, what does that mean for me? If I met 5 people, which I shouldn't have if I had a fever, and those 5 people have to stay home as contacts for 2 weeks till they're given the all clear, what does it mean for them? Do they have friends, family, community members who can shop for them? How will they keep busy? We need to start thinking of that, because I think if it comes here, many of us will be in that situation. And the better we do that, the lesser the impact will be. And also, if it comes to sustained community transmission, everyone said that people in China are very calm, even though there was quarantine. People in Italy are very calm. We all hear interviews. It's tough, it's scary, but you can just take a deep breath, deal with it, relax, and once it goes away in 2 to 3 weeks, life comes back. So I think we all need to visualize how we would behave, because that would be the trick to dampen the effect on the healthcare system, and that would be essential, I think, and that responsibility lies with all of us.
We
Do
have
you have
time
any
for
reason
2
to
more
believe that it's
questions.
going to be any
Steph,
worse in
Josh.
October than it is now?
Sorry, I'm just.
Do you have any
We have
reason,
a lot of people that are.
do you have any reason to believe it's going to be any worse in October than it is now?
Impossible to predict. 2009 H1N1 pandemic. ICU admissions happen in different parts of the world in March, April. That's when everyone became aware of the pandemic. COVID, it happened end December, early January in Wuhan. July, we saw something we never see in summer. We had and H1N1 impacted younger people more than older people. Seniors were actually much less affected by H1N1 than seasonal flu. So every virus is different. But in July 2009, we saw young adults getting sick and getting hospitalized.
Like the Spanish flu.
We saw the spike. Less worse than the Spanish flu that had a 1% mortality. This was like 0.1%. But we saw that spike in July. So even though we think influenza only goes around in winter, it was very different with the H1N1. And then we saw the second peak in September, October. Now for a flu vaccine, for an influenza pandemic, we had antivirals in July that we could give out. We had the vaccine. That we don't have. So our pandemic planning has to exclude those two very powerful tools.
Scott?
I wanted for the SHA, to date, have you purchased any more medical supplies just to prepare for the eventual or anticipated arrival, maybe in terms of ventilator masks, beds, whatever?
Certainly through identifying the impact, because we've worked with the ministry on modeling on what the potential impact could be, and our primary focus is ensuring that we have the appropriate personal protective equipment available, so masks, gloves, gowns, so on and so forth. So our supply chain group has been working very diligently based on the modeling that's been done to secure the appropriate vendors and supply to adjust to that increased volume. And everyone else in the world is doing the same thing, but that's why for me it's I think very beneficial. Us as a SHA as a whole is working as a single organization in partnership with the ministry and connecting with potential stocks or resources that can be made available through either the federal government or broadly through vendors.
So just to be clear, like to date, you haven't spent any money. We're still kind of in the planning, identifying phase of things?
No, we are actively going out procuring the necessary resources that we
I guess,
require.
what
Yes.
have you bought, how much? Like,
Oh, I can't speak to the exact numbers, but I
Okay.
know that just this morning we were talking about doing bulk purchasing, and we're working in partnership with the ministry to do some bulk purchasing on some items. There has been ongoing work around securing the necessary stock because we've seen an increased use of masks and so on and so forth. So in order to stay ahead of that curve, we were actively looking at improving our robustness of our supply chain so that we can meet the needs of not only the patients, but the staff that are caring for those patients.
Last question, Josh.
My question's also for the SHA. We stress about the public health risk, but what about the people on the front lines if the disease does come to Saskatchewan? Like, what precautions are in place for the doctors and the nurses that are dealing with it? Because obviously, we can't afford to quarantine doctors and nurses every time they're subjected to it, right? So what precautions are there for the doctors and nurses that deal with COVID-19 and their families?
Certainly, I'll let you comment and I can build on that. if
Really
necessary.
important question. Healthcare workers are really important in this. Good news is that study from Singapore just published. They were ready for this when it came. They used the proper personal protective equipment and all the other protocols that are important. No transmission in healthcare workers. I think that's really important to recognize that if you have the precautions in place, there's no transmission. And what that means is it starts with the individual who's sick. You call ahead. You don't go show up in an ER or waiting room and sit there and coughing. You call ahead so that through Healthline, through public health, so that you are seen in a side room. And testing that's happening currently is happening in a very safe manner. For high-risk people, the testing is at home. Testing is done through public health with primary care providers in a safe manner, no sitting in waiting rooms. Even though all the cases are negative, the protocol is the same. And if you were to needed care in the ER because you're very sick, short of breath, you're taken into the ER in a way that you minimize exposures to others. So there's a whole hierarchy of how you access a healthcare facility, and then staff use proper PPE, which is fairly straightforward. It's a procedure mask, eye protection, hand washing, and then of course in an ICU setting, other precautions apply. But I think the good news is that with the proper precautions, there's no transmission to healthcare workers, and if you use proper PPE, you're not considered a contact of a case. You can continue to work and see other patients as well.
So would some of those precautions mean the same doctors and the same nurses treating the same patients all the time, or what?
So right now, if you use proper precautions, mask, procedure mask, eye protection, and you see a patient with COVID-19, then you come out, you take your You sanitize your hands, you take your mask and eye protection off, and there's a video on the website, donning, doffing, it's really important. And then you're safe to see other patients. But during outbreaks, if you had a lot of people, it makes sense to cohort patients and staff on specific floors. That just makes it easier for staff to prevent cross-contamination. But I think South Korea and other countries are showing, and Italy, that you can minimize exposure to healthcare workers through all those protocols.
When will we likely know about the case at the Saskatoon Correction Center? There's been an email circulating basically saying they're looking at someone who has been exposed to coronavirus.
You know, we have had numerous situations in schools, universities, other institutions. We will not announce negative test results, and if there's a positive, we will in general speak to the situation and who potentially the contacts were, that they were contacted, but obviously we won't disclose any identifying
So at this
details.
point, you really can't say anything more. I should have asked you that. I'm sorry
Yeah.
for not asking you that more directly,
Yeah.
but I didn't have the information.
Yeah, but we won't, we would only announce a case if it was positive and in general give this context and confirm that we are following up with all the contacts.